So one of the things that I've noticed is happening more and more is that people like to be able to put their OCD into a category. Like, what type of OCD do I have? Is it ROCD, HOCD, POCD? There's always these new little acronyms coming up for like, what type of OCD do you have? And this might sound a little bit pedantic, but it's really important in terms of the treatment process, is that, in my opinion, there's only one kind of OCD, and that is OCD. Right? Because you can obsess and have compulsions about anything, okay? And when we try and separate it out into different types of OCD, we're kind of giving this idea that's your one thing and you can get treatment for that, and it's different to the other things. But actually what you tend to see in treatment is that if you only think of it as, okay, for example, I've got ROCD, relationship OCD, for example, and then you just think of it like that, what you'll end up doing is unwittingly treating the content of the obsessions rather than the process, which is paying too much attention to your thoughts and trying to get rid of the feelings. And what we really need is for people to understand that you can have unwanted thoughts and feelings about anything. So don't worry if you don't know what type of OCD you have, because if you think you have OCD, that's enough. And I think that's the other thing is, I know in all the literature it says there are these different types of OCD. And what I think that it means is OCD has a tendency to pick up on certain different themes. But of course, it's not limited to those themes. And so if you're somebody who has OCD that just doesn't fall into any of those categories, then you end up with this like, well, I don't have any of those. What's my thing? Then my thing's different and weird and unusual. And it might be a bit different and unusual, but the point is, if it has the same pattern as OCD, if it's having unwanted thoughts, images, urges, feelings, and then you do something, whether in your head or externally, some kind of behavior to try and get rid of those thoughts or feelings, then just call it OCD. You don't need to categorize it. Now, the only really useful reason to know what the theme is so that you know how to do your exposures. And that's why I've got some videos about specific different themes that OCD tends to pick on, but just basically so that I can give people ideas of what kind of exposures you can do. But you've got to remember that what we're doing is we're treating your tendency towards paying too much attention to your thoughts, trying to escape from or push your thoughts away and trying to escape from uncomfortable feelings. That's what we're treating. We're not trying to get you okay with, for example, the idea of harming someone or knowing for sure whether your partner is right for you. We are not focusing on the theme. We just use that theme to get you to a point where you can start to treat those thoughts and feelings differently so that you can live a life where OCD is not dominating it.